Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the founder and CEO of Particle Health, Troy Bannister. Troy, how are you today?
Hey Jared, thanks for having me.
Absolutely. Excited to have you. I know we've tried to do this in the past, so I'm glad it finally, the stars aligned. We did it. Yeah.
A beautiful Friday afternoon. Here we are.
Absolutely. Let's dig right into it. Tell us a little bit about your background, and then we'll talk about Particle Health.
Yeah, the quick summary, grew up in Seattle, was an EMT working in an ambulance through college, fell in love with medicine, ended up going to medical school out of Georgetown. Did not want to become a doctor late in that journey. And so I switched out and got a master's degree in biophysics, of all things. Brought that up to New York, where I got a job doing clinical research. I dipped into digital health while I was doing that research and kind of got enamored by what was happening. And this is, 2011, 2012, early days. And so I joined a small venture capital firm / accelerator called Startup Health out here in New York. Was one of the earlier folks at that team. And I got to meet thousands of entrepreneurs building all sorts of different healthcare tools and services. And that was where I saw this problem very acutely. All these really smart folks building these really great tools, but no access to patients' health history. And I thought, if we can do this in the financial space with like a Plaid, or the communication space with like a Twilio, or the payment space with like a Stripe, why can't we do this in the healthcare space? And it's kind of a naive set of thinking. Healthcare is way more complicated, but decided to jump in and do it anyway. And so started Particle about 4 years ago.
And so give us that, that additional overview of Particle Health today. What does the company look like? Key areas of focus, what's really exciting you about what you've been building?
So I think we wouldn't be where we are today without regulation and policy. And there's 2 big rules, the anti-information blocking rule and another rule called TEFCA, that are maturing right now. And those rules make what we do possible. They're giving individuals and other stakeholders in healthcare the ability to access patient data. And so we are riding off of these regulations, and we're taking the principles of those rules and turn them into technology at the end of the day. And so that's a very exciting thing. And I think the most exciting part of it is they're barely mature yet. There's still a lot that's going to be happening over the next couple of years. And there's also, I think, a big wave of new companies and coming into healthcare. It's obviously slowed down a little bit with the market, but there's thousands of new healthcare organizations that are disconnected from the traditional healthcare system that need some sort of interconnectivity. And I think that's where Particle plays such a pivotal role, is connecting these non-traditional healthcare organizations to the traditional healthcare organizations through interoperability platform like Particle. There's a lot more I could unpack too, but I think that general principle is just a big theme that's happening in healthcare where we're really focused.
And when you look at the landscape that you're in, right, what are some of the core differences between Particle Health and companies like Health Gorilla and Zeus?
Yeah, it's a great question. And I think I also look back on the finance space because a very similar thing happened. There was Plaid, Quovo, and Yodlee were the 3 big kind of finance interoperability. That's not really the right word, but let's call it that, companies. And if you look at what happened there, Plaid obviously won the battle, right? Now like a $9 or $10 billion business. All of them, I think, were acquired by Plaid or some other organization. I can't quite remember who bought them. But I think something kind of similar is happening in healthcare right now. The regulations are forcing open access to patient data. And there's, I think, really 3 vendors out there, us, Health Gorilla, and Zeus, that are really attacking this problem. And so it's really interesting to kind of compare those 2 industries to what's happening here at Particle or in healthcare today. So I think the difference, everyone tries to do it a little bit differently, right? There's a different kind of niche to fill. Particle is very focused on the data. And what I mean by that is cleaning, deduplication, standardization of the data, and then applying analytics and insights on top of it. We think of our product as the actual data. Zeus, on the other hand, is very workflow oriented. They're building UI UX tools. They're integrating into EMRs. I know John Bush pretty well over there. That guy is targeting Epic. How do I disintermediate Epic is his big mission in life. And then Health Gorilla on the other side is much more network oriented. They've applied to become a QHIN under TEFCA, Qualified Health Information Network. So they're going to be another network in the TEFCA infrastructure alongside groups like Commonwealth and eHealth Exchange. So we're all looking at the problem a little bit differently. And I think we're all approaching it a little bit differently, where we're really focused on how do we take all this data that's now open and accessible and extract the value from it and get that into our customers' hands, which is where this is our major focus here at Particle.
Super interesting. I like that phrase too. Like the extracting. How do we best extract the data, right? That you need to pull, because there is so much that you have to go through, right?
Oh, it's insane. I think our
Yeah,
average query returns 160 unique files per patient.
Wow. Yeah, that's
It's
a
a
lot.
lot. So that's not
That's a
helpful
lot.
to a doctor, right, at the point of care, right? You got 10 minutes to talk to your patient. You can't sift through 160 different documents. You need to know what is critical at that point of care to get through and then move on to the next patient. And you just can't do that without really advanced analytics and insights generation.
And at the same point, you still need all that information, right? Like
Right.
even like you still need to have it, right? Because you have some people you'll meet that will be like, then are we collecting, also too? No, you need all that information. You just need, like you were saying, a better way to analyze it in the time period that you have for patients.
Right.
Yeah.
I think step one is you have to get access to the data. Step two is you have to standardize it and clean it. Step three is you have to filter out what's important based on a use case. And then step four is you have to actually create some sort of insight from it.
And make it seamless all at the same time.
And make it seamless at cost.
Yeah, at cost. Yeah, it's definitely it's a difficult problem that you're solving, you're going after. So kudos to you and the team for, number one, just going after it, because I'm sure some days can be frustrating in this space, right? But appreciate all the work that you've done in it.
Yeah, thanks.
We didn't have the opportunity to link up at the Vive conference. We missed each other, but hopefully, the next one we'll see each other. Love to hear your thoughts on how the conference went. I know you had a booth there. So from your point of view, give us your Vive recap, some of the things that happened there. And I know we'd love to hear that.
Yeah, I think there's two interesting things to mention. Interoperability has always been like a huge buzzword at these conferences. And I think historically it's been all about, and going back to my framework I just laid out earlier, access, standardization, filtering, and then analytics. It's always been on the access piece. Everyone's been like, who do I go to get the most data? How do I go get more data? The conversation shifted now towards how do I actually get insights from the data? And I think that's a really good thing. It means the market is understanding that there are ways of accessing data now. When we started Particle 4 years ago, the biggest blocker we had in sales was, I don't believe you. We were like, all you have to do is put in the patient's name, date of birth, address, phone number, and we will find all their data 90% of the time. And every prospect we talk to is like, I don't believe you, man. Like, this is crazy. Now it's like, okay, we believe you, but like, what's the value? What's the ROI? What's the insight that you can help me generate here? And that's a huge, I think, signal that the market's maturing. People are understanding it, and it's becoming a need to have, not a want to have, for most of these organizations. So that's one major theme. The second theme is, I think we're now on the brink of having patient access as a option. So historically, we've only been able to share data with providers that are requesting it for patients. Right around the corner, patients are now going to be able to access their own records. And so one thing we did at Vive was we set up iPads, and we have a partnership with Clear. You might see Clear like in the airport, right? You take a picture of your face, take a picture of your driver's license, and like that, we can pull all your records from around the US. And so we set these demos up at Vive, and we're running some alpha programs with folks that are interested in signing up and accessing their own records. So this is a new thing, and I think this is the game changer. Right? I think once this is up and running and fully ubiquitous, it changes healthcare completely, in my mind. And maybe if we have more time later, I can talk about why. But I think this flips healthcare like literally upside down, and that's the exciting future.
Yeah, it changes the game, and it makes it less frustrating for the parties involved. Which, whenever you can do that, that's huge. What's next for Particle, Troy, that really excites you, that you can share here today?
So I think the advent of AI is incredibly compelling. I mentioned the problem before. We get 160 documents per patient. How do we generate the most insightful output from that AI plays a role in that problem, right? The being able to ingest and analyze large sets of data to produce one simple output in a very flexible and intuitive way, that's right around the corner. And I think if you're not investing in that now, you are going to be out of luck in a year from today. It's going to move so fast, right? That's the scariest thing about AI is how quickly it will mature. So I think that there is a really pivotal moment coming for all healthcare companies that orient around or anchor to data. And if you're not embracing that now, good luck next year.
Well, Troy, I really appreciate you coming on. Hopefully, we can have you come on again in the near future. We can maybe put together a panel, dive into more of this even deeper. But I really appreciate you coming on, telling your story, diving through some of the cool things that Particle Health is doing, and wish you all the best.
Awesome. Thanks for having me.